Pediatrics by Dr.Anand. Comment on this. This is 0 by 30 global strategic plan to end human deaths from dog-mediated rabies by 2030. This global strategic plan was taken on the day World Rabies Day, 28th September 2017. This was the theme for the World Rabies Day. Countries will lead efforts driving the changes needed to reach 0 by 30. Rabies is a deadly disease. It has been neglected, and so they came up with something like 0 by 30 so that they build sustainable institutional capacity and end human deaths from dog-mediated rabies. This 0 by 30 is empowered by the United Against Rabies collaboration. Rabies virus belongs to Lysaviridae family. It is transmitted by the bite of the infected animal. The most common reservoir is dog. So through the saliva of the infected animal, rabies is transmitted.
Hello everyone, welcome to Pediatrics by Dr.Anand. As you can see this pic, this is everything you need to know regarding rabies post-exposure treatment. I'll just little zoom the pic. See, this is category 1, 2, 3. See, it's very important, you need to know which category the patient is landing into. According to that, you will give the vaccines or serum to the patient. So category 1, you have licks on intact skin. Category 2, any patient comes to you with minor scratches or abrasions, that is without bleeding. And category 3 will be single or multiple bite with bleeding or contamination of the mucous membrane. That's very important. So going further, after category 1, 2, 3, we need to know who has bitten: the dog, the monkey, the cat, the other, and is the dog, monkey or cat is dead or are they alive. That's very important for us to know. And you must have seen date of exposure or bite and site of bite or multiple bites. That's very important. So next you can see down below, wound management, that is the thing. So washed immediately by patient, yes or no? Antiseptic application, yes or no? I'll little zoom out for you all if you can see this now. Number 3 is wound washed at facility, and number 4 is ERIG infiltration. So you need to know very important about the care of animal bite wounds. First step is thorough cleansing of the wound with soap and flushing under running water for 10 minutes, followed by the irrigation of 70% alcohol or povidone iodine. That is number 1. Number 2, antimicrobials and this TT should be given if indicated. That's very important. And this RIG, what is RIG? Rabies immunoglobulin. So that's very important. And according to the category, we use this rabies vaccine or the serum. Okay, then coming to this very important post-exposure vaccination record route of administration. That's very important. Each line is important. Okay, patient comes to us, our hospital is very famous for a lot of dog bites, and we treat a lot of patients like that. So any patient comes to us, first we'll see which category the patient belongs to. If the patient belongs to category 3, then you all know that this the post-exposure vaccination category will be day 0, day 3, day 7, day 28. We have this, you can see these days corresponding, you have the date due, and corresponding you have the date given and the signature of the doctor. That's very important. So patient comes to us, first we will write the hierarchy of the rates. Secondly, we will give TT. DT has to be given to every patient. That's very important. And category 3, if the patient lands into, you will give ARS also, anti-rabies serum. This day 0, 3, 7, 28 was ARV, anti-rabies vaccine. And if the patient landing into category 3, then you give ARS, anti-rabies serum. Half you give local at the wound and half you give intramuscular. That's very important. This is the basic immunization card you need to know. And last, very important points you need to know. See, one is ERIG, one is HRIG. HRIG is human rabies immunoglobulin, and ERIG is equine rabies immunoglobulin. Again, PG entrance question, what's the dose? 20 IU per kg, that's for HRIG, human rabies, and for equine it is 40 units per kg. That's very important, you need to know. Okay, and I have already told you how to administer in category 3. You give half, you give over the wound, and the remaining part you give intramuscular into the deltoid region, or even anterior lateral aspect of thigh also you can give. That is very important. And that's it. And the last but not the least, very very important, okay doctor, my child 1 year back or 1.5 year back, he was very well vaccinated prior, like 1.5 year back he was bitten by a dog. He was category 3 and he took all the vaccinations, doctor. So now after 1.5 year, again my baby is coming to you. So doctor, now how many injections will you put, or how will you do? That's very important. Children who have received previously full rabies post exposure prophylaxis should be given only 2 booster doses intramuscular on day 0 and day 3. That is very 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 important. And in these cases, in these babies, immunoglobulin you will not give. You understanding what I'm saying? This ERIG or HRIG, immunoglobulin which you're talking, 20 IU and 40 IU per kg, that you will not give if your child is having previously full rabies post exposure prophylaxis. Please, that is very important, you need to know. And I think that's all about rabies. We have finished about the post exposure categories, care of animal bite, and about the rabies immunoglobulin, how to give indication. And category 3 wounds, that is indication for rabies immunoglobulin. It is indicated in all cases of category 3 wounds, okay. And this rabies, you have human and equine. Human is 20 and equine is 40 units per kg. And that's it. I think that's all about the rabies immunoglobulin vaccine. I hope you had a good watch in the video.